Did you know 1 in every 2 women in India suffer from anemia? With over 52% of all pregnant women and 57% of all women in reproductive age 15 to 49 estimated to be anemic, India faces a real threat to women's and child health, as well as social and economic costs. Hello everyone, I am Dr. Tulika Seth, Professor, Hematology, AIIMS, New Delhi. Today, let's talk about anemia. Children and adolescents experience physical and cognitive delays, lowered performance at school. Adults also suffer anemia in pregnancy and is dangerous both to the mother and baby. When you have anemia, you could have lower hemoglobin in the red blood cells or less numbers of red blood cells. The most common causes of anemia are nutritional deficiency of iron, B12 or B9. Other causes are blood loss from bleeding like heavy periods, stomach ulcers, piles, etc. Sometimes anemia is due to a bigger illness like an infection or bone marrow disorder. Inherited conditions like thalassemia and sickle cell disease make red blood cells break easily. Even some medicines can lead to anemia. We must find the cause to treat it completely. Without treatment, anemia can become severe or even fatal. Anemia can affect infants to the elderly. Pregnant women who are anemic are at risk of severe complications during childbirth, including danger of postpartum hemorrhage. Anemic mothers are more likely to have preterm, small for gestational age, or low birth weight babies. Anemia is so common, it is sometimes overlooked. It can cause tiredness, pale skin, hair fall, and cravings for chalk or ice. It can also lead to irritability and trouble focusing. If it worsens, it may cause breathlessness, a fast heartbeat, and even heart problems. Doctors will need to do tests to find out the exact cause of anemia so that they can treat it and check if it was related to any other illness. Treatment depends on the root cause. The commonest nutritional anemia is iron deficiency anemia. This occurs usually due to a poor diet or excessive blood loss, or even difficulty absorbing iron due to chronic illness or intestinal problems. In rare cases, genetic problems affect iron metabolism. Addressing the cause through better nutrition, iron supplements, or treating the underlying health issue is key to recovery. To prevent anemia, high-risk groups like pregnant women, adolescents, and the elderly should eat iron-rich foods like green leafy vegetables, dry fruit, whole legumes, millets, local fruit, and non-veg options helps to prevent it. Pair them with vitamin C for better absorption and limit tea or coffee. Supplementation of iron includes oral or intravenous iron medicines or iron-fortified rice, which plays a big role in prevention and treatment. Government of India provides free of cost supplements and screening across health centers. Inherited anemia like thalassemia or sickle cell can run in families. In the carrier state, they are mild and do not lead to much problems. However, when both parents are carriers, there is a 25% risk of having a child who could face lifelong treatment. Testing of pregnant women can be done for thalassemia carrier and sickle carrier state. If only one partner is a carrier, there is no risk to the child. Hence, the couple should meet the doctor to assess their risk before planning a family. Think of anemia like a hidden crack in a foundation. If left unchecked, it can grow into a serious problem. Don't ignore anemia. Get tested. Thank you. Namaste.